Shall we start, Sanjana?
Yes, we can start now.
Okay. So yes, doctors, very good afternoon to all the doctors. For topic for today's webinar as everyone knows, the topic for today's webinar is to know the missing link in your enzymatic preparation. To shed the light on this topic, we have with us Dr. Satish Kumar. And Dr. Satish Kumar is an MDS periodontist. He has more than 15 years of clinical experience. Dr. Satish Kumar mainly focuses on perio and implant surgeries. He has been speaker at many IDA events and other forums. Dr. Satish Kumar has his own YouTube channel in name of Kazan Dental. He has more than 50,000 followers on that YouTube channel. He has authored two books, the BDS Launchpad and the Dental Launchpad. So yes, we welcome Dr. Satish Kumar and I hand over the session to him.
Thank you, Dr. Nitin.
Thank you.
Uh, we have been doing these sessions frequently, and there's one question which always keeps bothering me कि हम लोग सुबह सेशन रखे, there are people, दोपहर में सेशन रखे, there are dentists. You have sessions related to dentistry on Saturday, Sunday, फिर भी dentists आके सुनते हैं. And it's not just that कि young dentist है तो उनको जानना है या उनको सीखना है. It's even senior dentists who are practicing since 5 years, 10 years, 15 years, 20 years. Take out time, that is either in the afternoons between their morning and evening practice या फिर Saturday, Sunday जब उनको actually छुट्टी का time रहता है to come and upgrade their dental knowledge and dental skills. And have you wondered कि हम लोग ये क्यों करते हैं? Why do dentists actually put in so much of effort? When you ask dentists, वो लोग usually तीन answers देते हैं. The first is, I want more patients. The more knowledge I have, the more I can treat, the more patients I will get. The others are very simple with it. I need more income. Income so that I can sustain myself, I can take care of my family, and I can take the care of people around me. And others say that कि हम लोग ये इसीलिए सीखते हैं so that we are satisfied that we are giving the best treatment to our patients. And when we go out, our patients and our colleagues and peers respect our quality of work. But इसका bottom line क्या है? What do you get? How would you get more patients, more money, and more satisfaction? The answer is by having happier patients. So if your patients are happy, they will get more treatment done. They will again come to you for other treatment. They'll be willing to spend more at your dental clinic, and your dental colleagues and your patients would respect you, and you would have this satisfaction that you are giving better treatment to your patients. तो bottom line क्या है? We all want happy patients. But कभी हमने ये सोचा है क्या? What do our patients want? And it's not one type of patients who walk into your clinic. You will have that old uncle walking into your clinic with all his teeth shaking. There would be this young couple who would be an IT crowd walking into your clinic. They might have a business, they might be working, having parents at home, having children, and between all that, they want to take care of your kid. On the other hand, you might have a young child who either smilingly walks into the clinic or holding their parents' hands with this fear of whether they should walk in or not. That fear is intimate to them. So what do these various patients want? आपके क्लिनिक में जो पेशेंट आता है उसको क्या चाहिए? Why he is even coming to you? Most common funny answer जो हम लोग डेंटिस्ट देते हैं is, my patients want only discount. They come to me or they go to any other clinic, even if there is a difference of 200 rupees, they'll go and get treatment done there. Yes or no? But I want to ask you this question. Have you seen clinics where they charge a huge sum and still the clinic is completely packed? उसके बाजू में there is a clinic who charges a very low rate and still they find it difficult to fill in their chairs. होता है कि नहीं? ऐसा नहीं कि all expensive clinics are not doing well, right? There are clinics who are charging a bomb and are still doing really well. So this answer that कि patients only come for discounts does not work. Then what is the second thing? Ideal treatment. I want to ask you, what is an ideal treatment in a root canal? 0.5 mm short of the apex? Proper obturation? Have you seen that patient who has walked into your practice, got a root canal done, maybe 5 साल पहले या 10 साल पहले, एकदम short सा root canal. पेशेंट को बिल्कुल कोई तकलीफ नहीं है, नो डिस्कम्फर्ट whatsoever in that tooth. You do an ideal treatment, maybe a composite class 2 with all your band, matrice and everything, or you do an obturation. Perfect from the apex. And the patient has pain. Patient क्या बोलता है? वो जो ट्रीटमेंट किया था 10 साल पहले कोई दिक्कत नहीं है, बट ये ट्रीटमेंट से दिक्कत है. सो बेसिकली पेशेंट को समझ में नहीं आता है what is a perfect obturation, what is a perfect contour, what is a perfect cusp build-up. So if patient does not want good treatment, patient does not want discount, patient आता क्यों है? What do they actually want? There are basically three things. One is they require function. Means when I go home, जब मैं घर जाऊँ, I should be able to eat. खाने पीने आना चाहिए. Second, it has to be aesthetic. कि मैं बाहर जाऊँ, लोग मुझे बोले कि your smile is good, your smile looks good, your teeth look nice. That is what they want to hear. And the third thing is treatment के दौरान, that is during treatment and even after treatment, they do not want to have a lot of pain and discomfort. So basically, they want function, they want aesthetics, and they want less or no discomfort during and after treatment. तो अभी फंक्शन और एस्थेटिक्स के लिए आई एम श्योर यू आर कंटिन्यूसली अपग्रेडिंग योर स्किल्स. यू आर लर्निंग more about composites, more about root canals, more about implants, more about extractions, so that you are a good dentist. But when it comes to less pain or less discomfort during and after treatment, हम लोग क्या करते हैं? One, we give anesthesia. We have different anesthetic techniques. Second, हम लोग medicines prescribe करते हैं. पर अभी एक मेडिसिन होता है इन्फेक्शन कंट्रोल के लिए, दैट्स एंटीबायोटिक्स. Second medication we give either for pain. Now, what is pain basically? Is it actually a pain medicine what we are giving? We are giving something which is an anti-inflammatory medicine. क्यों? क्योंकि हमें सिर्फ पेन को नहीं काबू में करना है. Pain is just a sign of inflammation. And what is inflammation basically? Now, inflammation is a body response. मतलब आपको किसी ने चोट पहुंचाई तो बॉडी का कुछ तो रिएक्शन होगा. तो this reaction from the body is known as inflammation. It can be due to anything. Either you injure it with trauma, put a chemical, it can be bacterial, viral infection, or any injury causes a body reaction. और अभी ये inflammatory reaction में you have basic 5 signs जो हमने physiology में पढ़े थे. First is heat, second is redness, third is swelling, fourth is pain. Dentistry में commonly we see these 4 signs. Other than this, the fifth sign or loss of function, जिसको हम लोग functionalacia बोलते हैं, that is not always seen in dentistry. It is sometimes seen when the patient has a swelling or an infection close to the third molar. Means उनके TMJ open करने में issue होता है or their inability to speak, inability to open their mouth properly. Other than that, majority of times dental clinic में we take care of heat, redness, pain and swelling. Heat और redness तो patient को उतना समझ में नहीं आता है. Mainly patient आके क्या बोलता है? मुझे वहाँ पे सूजन आया है दांत निकालने के बाद, या मुझे दर्द हो रहा है आपने इम्प्लांट डालने के बाद. सो हम लोग जो प्रोसीजर करते हैं उसके बाद पेशेंट कंप्लेन मेनली क्या करता है इज इन्फ्लेमेशन. सो व्हाट वी हैव बीन प्रिस्क्राइबिंग इन डेंटिस्ट्री सिंस एजेस इज बेसिकली एंटी इन्फ्लेमेटरी मेडिकेशन, NSAIDs जो बोलते हैं. नाउ द पॉइंट इज बिफोर वी प्रिस्क्राइब इट, क्या ये नहीं जानना है कि हम लोग क्यों प्रिस्क्राइब करते हैं? What is inflammation? What reactions do these inflammation cause? And do we actually need to control it? If we need to control it, are there better methods to control it? So the first thing is we need to understand कि दो टाइप के inflammation होता है. One is acute, the other is chronic. Acute means you've caused an injury and there is an immediate response. This can be allergic reaction, frostbite, burn, trauma, anything of that sorts. Chronic inflammation is वहाँ पे एक इंजरी है और वो कंटिन्यूस वहाँ पे इरिटेट किए जा रहा है, जस्ट कीपिंग ऑन नैगिंग इन दैट एरिया, एंड देयर इज अ लॉन्ग टर्म कॉन्सिक्वेंस ऑफ इट. इट कैन बी एनीथिंग. आपके जो कार्डियोवैस्कुलर डिजीजेस है दैट कम अंडर इट, योर आर्थराइटिस कम्स अंडर इट, ऑटो इम्यून डिजीजेस, एंड इन सर्टेन केसेस द कैंसर, न्यूरोलॉजिकल डिजीजेस, और आर बेसिकली body's response to chronic inflammation which is happening out there. Now, ये इन्फ्लेमेशन होता क्या है एंड हाउ डज इट एक्चुअली ऑकर. रिमेंबर, आप एक बार गाड़ी से जा रहे थे, यू वर पासिंग बाय एंड यू माइट हैव सीन एन एक्सीडेंट टेकिंग प्लेस ऑन द साइड ऑफ द रोड. हुआ है कि नहीं? What happens in an accident? Soon as an accident takes place, the people out there, either they are involved in that accident or the people who are sitting and saw the accident, वो लोग कॉल करते हैं. एक जन पुलिस को कॉल करेगा so that they can come and take control of the situation. कोई अगर मेजरली इंजर्ड है, they will call the ambulance to again come take care of the situation. बाकी लोग क्या करेंगे? अपने फ्रेंड्स को बुलाएंगे, भीड़ इकट्ठा करेंगे and they will just surround and stop and sit and see what is happening. Similarly, inflammation में भी यही होता है. Whenever there is an injury or a trauma out there, there are cells which are present nearby which send out mediators. ये mediators क्या करते हैं? बाकी सारे inflammatory cells को बुलाते हैं वो साइड पे. So these mediators can be like cytokines, chemokines and so on. अभी when you see the road passing by, those people who see the accident site, वो लोग भी आ जाते हैं. Similarly, there is a plasma supply or your blood vessels which are passing through. Soon as they see a trauma out there, you have cells from your blood vessel which open up through the blood vessels out there and enter into the site. So these are inflammatory cells and they cause an inflammatory reaction out there. उनमें से certain cells are absolutely useful, like your police and your ambulance. They come, they clean up the site, they take care of the injured tissues. Injured tissues को regenerate करते हैं, new blood vessels form होता है, and वहाँ पे healing होता है. But then there are sometimes excessive inflammatory reactions out there, जिसकी वजह से you have fluid accumulation, जिसकी वजह से patients end up having swelling, patients end up having pain. So your point would be inflammatory mediators दो टाइप के हैं, एक प्लाज्मा सेल डिराइव्ड और एक सेल डिराइव्ड. केमिकल मीडिएटर्स दो टाइप के होते हैं, प्लाज्मा डिराइव्ड और एक सेल डिराइव्ड. सेल डिराइव्ड इज बेसिकली द सेल्स अराउंड देयर एंड प्लाज्मा इज द वंस व्हिच केम फ्रॉम द ब्लड वेसल्स. और एट डेंटिस्ट हम लोग ये क्यों सीख रहे हैं, हमें ये क्यों सिखाया गया है फिजियोलॉजी में, व्हाट इज इन्फ्लेमेशन, हाउ डज इट वर्क, हाउ डज इट एक्ट एंड एवरीथिंग. व्हाई शुड वी एज डेंटिस्ट इवन केयर? द रीजन इज हम लोग जो भी ट्रीटमेंट्स करते हैं, majority of them, we are either seeing patients who already had trauma. Maybe they had a fractured tooth, maybe they had an injury, maybe they had a burn, maybe they had an ulcer, or we are causing these inflammatory reactions. अगर हम लोग दांत निकाल रहे हैं, हम लोग क्या कर रहे हैं? ट्रॉमा, राइट? अगर हम लोग इम्प्लांट के लिए ड्रिल कर रहे हैं, हम लोग क्या क्रिएट कर रहे हैं? ट्रॉमा, राइट? सिंपल सा चीज, suturing also, we are creating inflammation out there. Yes, हम लोग ये इसीलिए कर रहे हैं so that though there is a small short term injury to the patient, long term में patient को फायदा होता है. Basically short term pain for long term gain, ये हम लोग करना चाहते हैं. But अभी pain तो हुआ है, so whose responsibility is to take care of it? Us as dentists. This is similar to Salman Khan's dialogue, मारेंगे भी हम ही, बचाएंगे भी हम ही. So we are creating short-term pain for long-term gain. But अगर आप कोई भी पेशेंट को पूछो कि आप डेंटल ट्रीटमेंट क्यों नहीं कराते हो, majority of them will tell you it is because of fear of pain during and after treatment. इसीलिए वो लोग ट्रीटमेंट नहीं करते हैं. So as dentists हमें क्या चाहिए था? स्टार्टिंग में हमने डिस्कस किया था, हैप्पी पेशेंट्स चाहिए. तो what we have to do? We have to see that they have less discomfort and pain. And pain के लिए कब आता है? In which site of the healing do you see pain? It is during the inflammatory phase. During the initial phase, if hemostasis, हम लोग क्या करते हैं? We either give a suture, we either use a collagen plug, we either put a pack of cotton. Later in the proliferative and remodeling phase, patient को उतना discomfort नहीं होता है. So our concern is to take care of this inflammatory phase. And for inflammatory phase, हम लोग इतने सालों से we are giving only one thing, that is NSAIDs, anti-inflammatory enzymes. But in today's day and age, जब बहुत सारी टेक्नोलॉजी बढ़ी है, we have realized that there are certain enzymes, अगर हमने हमारे पेशेंट्स को दिए, then automatically the amount of inflammation they have reduces and the healing is much better. So now Once we know that there are these enzymes, is it not right कि हम पता करिए कौन सा एंजाइम है, क्यों देना चाहिए और इससे एक्चुअली कुछ फायदा होता है कि नहीं. वैसा एक एंजाइम कॉम्बिनेशन इज टॉलिब. नाउ दिस enzymatic combination of टॉलिब comes from hetero healthcare. Hetero healthcare is a company which is seen in more than 120 countries across the world. Means ये सिर्फ एक local Indian company नहीं. It's like how Infosys operates across countries, how Reliance operates across countries. It's a medical pharma company from India which is operating across the world. So we can be sure that their medicines are of good quality. Now, ये टॉलिप उन्होंने क्यों निकाला है? Why have they come up with a combination of 4 enzymes? Let's dissect each and every enzyme. उन्होंने क्यों डाला है और इससे एक्चुअली कुछ फायदा है क्या, और है तो क्यों देना चाहिए. So the first enzyme which is used is trypsin. ट्रिप्सिन, अगर आप आपके फिजियोलॉजी के चैप्टर्स में जाओगे, दिस इज ऑलरेडी एन एंजाइम which has been which is already being created in our body. So it is created in the pancreas and it enters into the digestive system to the pancreatic duct. So if your body is already creating this enzyme, हम लोग बाहर से क्यों दे रहे हैं? What is the added advantage to it? The answer is it has three major mechanisms. First, it helps reduce vascular permeability. Remember the start I told you in inflammation, when there is an accident, people from the road jump in. Similarly, the inflammatory cells jump from the blood vessel into the cell area out there, which you want to reduce. How do you reduce it? By decreasing the blood vessel permeability. Second, there are these pro-inflammatory mediators. मैंने याद है स्टार्टिंग में बोला था, they call their friends and ask them to come. These are those cytokines which ask other inflammatory cells to enter the site. And what does trypsin do? It reduces these mediator action. And the third thing is it does fibrinolysis. What is fibrinolysis? Imagine कल आपके क्लिनिक में दीवार पे होल हुआ, there's an accident or something happened and there was a damage in your wall. What would you do? You would call the karigar, you will ask them to do the entire plastering, cementation and get the entire work done. Once the work is done, what do you want? That area which was completely of debris and everything should be cleared, right? But what happens during inflammation? Inflammation, may you have all these inflammatory cells and mediators coming there. They would seal out the site, help with healing and everything. And there is an excessive production of fibrin out there. You want that excessive clot and fibrin which has been formed to be cleared up as well, so that there is less pain, less swelling and faster healing. So this is fibrinolysis and trypsin helps in that. So basic three functions is decrease in vascular permeability, it helps in reducing the mediator action, and third, it helps in fibrinolysis. Now trypsin, हम लोग बोल रहे हैं कि इतना सारा यूजेस है and already the body is producing it, so it is a safe enzyme. Actually काम करता है क्या? Just because हमने research पढ़ा है, does it actually make sense? मतलब मेरे क्लिनिक में मेरे पेशेंट को काम आएगा क्या? And the answer is trypsin has been used by our medical colleagues. It's not a new enzyme. जो MBBS doctors है have already been prescribing this enzyme for anti-inflammatory and thrombolytic properties. And not just in ulcers, they're even using it for arthritis and even in ocular or that is eye disorders. So imagine this is an enzyme which we know is effective, which is safe and produced by the body, and it is used by our medical colleagues. So what is stopping us dentists from prescribing this enzyme? The next enzyme is bromelain. Now bromelain is obtained from basically pineapple, the stem and fruit of it. So again, a safe enzyme. तो हम लोग पाइनएप्पल से निकाल के कुछ दे क्यों? Why do we do it? It's because it has a large number of actions. First is similar to trypsin, it reduces pro-inflammatory mediators, that is prostaglandins. It also reduces immune response by acting on tuberous necrosis factor alpha, interleukin 1 beta. Other than this, the actions which were similar to trypsin, there is one different action in bromelain. That is, वहाँ पे fibrin form होने के बाद trypsin used to help clean it up. Here, bromelain prevents initial platelet aggregation. So starting में ही it tries and acts and reduces aggregation of platelets or clot formation so that the inflammatory action is lesser and the patient feels less discomfort or swelling out there. Now, similar to trypsin, bromelain has been used by MBBS doctors. Mainly, उन्होंने एक study किया था in sports injury cases. Before the surgery, when bromelain was prescribed, they saw that post-surgery the healing was faster. And not just in this, it has also been used in arthritis, chronic inflammation, malignant diseases, and autoimmune diseases. So again, similar to trypsin, an enzyme which is effective, which is safe, and which is being used by our medical colleagues. So what's the third enzyme? It is rutoside. Rutoside is again commonly found in buckwheat, tea, apple. So an enzyme which is safe. Now its actions are similar to trypsin and bromelain. That is, it prevents platelet aggregation similar to bromelain. It decreases vascular permeability similar to trypsin. It improves vascular flow out there. It strengthens the capillaries and suppresses interleukin 1 beta and tumor necrosis factor alpha, which are basically mediators which call in other inflammatory cells onto the site. Now, same question. Is rutoside effective? And the answer is again yes. Rutoside was prescribed by MBBS doctors commonly for various inflammatory diseases. So again an enzyme, effective, safe and prescribed by MBBS doctors. Moving on to the fourth enzyme, which is the magic enzyme. जो हमने पहले तीन enzymes discuss किए थे, you will get a combination of those three enzymes in other drugs as well. But there are not many drugs which add papain to the mix. And why should you add? तीन enzyme है तो चौथा enzyme add क्यों करना है? For that you need to understand what is papain. Papain is basically obtained from papaya. Papaya jab when it is raw and it is hanging on the tree, they give cuts on it and उसमें से एक whitish liquid आता है. It's a latex. From that whitish latex liquid, they get this enzyme known as papain. And papain has multiple functions. First is it strengthens the blood vessels. Strengthening से क्या होता है? Reduce vascular permeability. उससे क्या होता है? Reduced swelling. It has an anti-inflammatory effect by reducing mediator enzymes. It has antioxidant properties and improves microcirculation. Why is this important? याद है हमने fibrinolysis में discuss किया था. It is basically cleaning out the debris. Once this debris is collected, it has to be removed from the area as well. For that, improved microcirculation helps. So papain again is a safe enzyme which is got from basically a plant, and it is absolutely effective when it comes to anti-inflammatory action. Similar to the three enzymes, it has been prescribed by our MBBS colleagues. Mainly in injuries, trauma, burn, they have found it to be very effective. Not just that, they have tried it in various type of ulcers like diabetic foot ulcers, leg ulcers and pressure ulcers. So an enzyme which is effective, enzyme which is safe, an enzyme which is not available in the other drugs in the market. Your question will be to it कि हम लोग एक एंजाइम क्यों नहीं देते, चार एंजाइम मिलके क्यों दे रहे हैं? The answer is same like Team India. If you have one person doing the job, you do not know whether it is always effective or not. But when you have four enzymes working synergistically, the action is better and stronger. It's for example, हम लोग सिर्फ amox नहीं देते. We give amox clav wherever we feel amox is not going to be effective, and there would be an antibacterial action. So you add clav to it. Similarly, you add a group of enzymes which you know together will work really well. But इतना सारा बोलने के बाद, as dentists, our question is, okay, effective, okay, it has been shown to be useful for MBBS doctors, but should we dentists prescribe it? Dental patients अलग ही है. They are not similar to MBBS, the patients which MBBS doctors see. So मैं एक extra medicine add कर रहा हूँ. My patients have to pay for it. is it actually effective? The answer is, I will ask you a question. If I give you a medicine and I will ask you to study whether it is effective or not, what will you do? आपके क्लिनिक में अगर फॉर एग्जाम्पल 10 पेशेंट्स आते हैं, सेम ट्रीटमेंट, मे बी आर रिमूविंग अ विजडम टूथ. In 5 patients, you will prescribe Tolib. In 5 patients, you will not prescribe Tolib. And after a few days, you will assess both the patients, correct? And you will see कि जिनमें मैंने Tolib दिया, do they have less pain? Do they have better healing? Do the patients say they have less pain? This is based on the VAS score कि हम लोग पूछते हैं कि पेन कितना है 1 to 10 के चार्ट में. So based on all that, हम लोग डिसाइड करेंगे कि whether Tolib is effective or not. Correct? This exact study was done in Savita Dental College, where they found 60 patients who required wisdom tooth extraction. They were divided into two groups of 30 each. One was prescribed Tolib, the other was not prescribed it, other than the regular NSAIDs. And after the surgery was done, after a few days, they assessed. The patients who were given Tolib showed better healing, showed better pain thresholds, means they had less pain and discomfort. You can clearly read it in the article which I mentioned. Conclusion: use of papain appears to be associated with reduction of soft tissue swelling and improved mouth opening when compared to the conventional therapy. So now it has been proven that this helps our patients. The other thing you need to remember is this comes from a brand which is Hetero Healthcare. Now, why is this important? You remember the instance which happened where a doctor prescribed medicines to children and a lot of children died? That is when you just try and use generic medicines which might be substandard. You do not know whether you are giving your patients a benefit or it is doing harm. When you're giving medicines from a standard brand and you know there is research done behind it, the confidence you know that it will actually do the right job is what matters. So now that we know Tolib is beneficial, the question would be कि देना कब है? According to me, it should be given in all cases where you're expecting edema, swelling, inflammation. That could be third molar surgeries, that could be extractions, that could be dental implant placements, that could be patients who have come with trauma, who have maybe a surgery done, anything of that sort, BSSO surgery or any surgery where inflammation is expected, it should be prescribed. If you ask what the dosage is said to be twice daily as long as required. But my question to you is, as long as required means what? Lifelong to nahi dene wale, right? It is basically for how long you expect inflammation out there. So most of the procedures, when you're doing a normal tooth extraction, how much time do you expect pain and swelling? 3 to 5 days? Give it for 3 to 5 days. When you're doing a third molar surgery or a advanced implant surgery, what are you expecting it? 7 to 10 days? Give it for 7 days or 10 days. So basically, for how many days you're expecting pain and swelling, for those many days you have to prescribe this medication. That is plain and simple. Now, the next question is, जब मैं ये prescribe करूँगा, is there any reaction from the patients? And I want to take you back to your pharmac lecture. जब कोई भी drug होता था, what used to be the side effect? Nausea, vomiting, diarrhea. Similarly, Tolib ka most common thing is nausea, vomiting, diarrhea, with very few patients telling they might feel giddy or tired. That is fatigue. Now, we are prescribing this. We know that there are no major side effects. But should we prescribe it to every patient? Are there any contraindications? So there is two sets of contraindications which I would really suggest is, one is if the patient is on a blood thinner like warfarin. Remember the start we discussed bromelain. How does it act? It prevents clotting mechanism. So patient में अगर you have already reduced the clotting mechanism by giving a blood thinner like warfarin, you would not add Tolib. Second, if the patient is on sedative drugs. So these two categories, you are 100% required to avoid Tolib. But there is one category I would tell you should be a little safe. That is basically in pregnant and lactating women. Now in pregnant and lactating women, ऐसा नहीं कि Tolib is shown to cause any harm. But we do not have enough research. So if you do not have research as dentists, why do we know our first part of Hippocratic oath is do no harm. So if you know कि हमें पता नहीं है कि कुछ होगा नुकसान कि नहीं, सेफ्टी के लिए मत देना. So don't give it to pregnant women or lactating mothers. Don't give it in patients who are on blood thinners and those who are in sedative drugs. Other than that, it is safe to prescribe it in all conditions. And why should you prescribe it? Let's circle back to the start. हम लोग बैठ के ये लेक्चर्स क्यों सुन रहे हैं? Because we want to provide better treatment. Why do we want to provide it? So that we have happier patients. And why do patients complain of dentists? Is because they have pain during and after treatment. ये तो सुना होगा ना, patients come and tell you वो दांत निकाला था, बिल्कुल पता नहीं चला, सूजन ही नहीं आया. दूसरे डॉक्टर ने दांत निकाला, बहुत सूजन आया, 7 दिन तक तकलीफ हो रहा था, मुंह खोलने नहीं हो रहा था. करेक्ट. Maybe the person who did and the patient had a lot of swelling was a complicated extraction, and the other place it might have been a grade 2 teeth, a grade 2 mobile tooth, but the patients don't understand that. So that we are that good dentist where the patients tell good about us कि दांत आपके पास निकाला, आपने दवाई दी, उसकी वजह से बिल्कुल तकलीफ नहीं हुआ. So prescribe Tolip so that you have better anti-inflammatory action, better, less swelling, faster healing, happier patients, and a better practice. With that, we end today's session.
Participating doctors, if you have any doubt or questions, you can just type in the chat box. If you have any doubts, you can type in your queries in the chat box. Yes, so far so good. Dr. Satish, thank you so much for this informative session. I hope most of the doubts, questions are cleared. Whereas Tolib is concerned and Papen has an advantage, definitely. Are you there, Dr. Satish? So far, so good. So I guess there's no question from the audience side. So thank you so much for this wonderful insight and wonderful session. I guess most of the doubts are cleared in terms of Papen as an advantage and Tolib as a product. And thank you so much for joining me, Doctor. Thank
Thank
you,
you.
Dr. Satish. Yeah. We end the session here. Yeah.